I would like to thank the scientific committee for selecting our work to be presented at this Congress, and I'm going to talk about the predictive factors of oligomonocytic chronic myelomonocytic leukemia evolution to avert chronic myelomonocytic leukemia. I have no financial disclosures or conflict of interest to disclose. And well, first of all, oligomonocytic chronic leukemia is a newly proposed definition for those myelodysplastic syndromes that have a monocytosis of more than 10% and a total count of 500 to 1,000. Recent investigation supports its consideration as a subtype of chronic myelomonocytic leukemia since they share a very similar morphological, genetic, molecular, and immunophenotype profile with chronic myelomonocytic leukemia. A recent work from our group showed that these two entities share a very indistinguishable molecular mutation profile, and that the percentage of MO1 monocytes in peripheral blood was very similar. It was also shown that oligomonocytic leukemia that evolved to chronic myelomonocytic leukemia had a worse outcome than those who did not. The aim of our work is to identify factors for predicting oligomonocytic leukemia evolution to CMML. We had the clinical genetic immunophenotypic data of 94 patients. At a median follow-up of 42 months, 30% of oligomonocytic chronic myelomonocytic leukemia evolved to CMML. And interestingly, we saw 4 different patterns. One pattern that didn't evolve to CML, another pattern that didn't evolve to CML, but had through time some determinations over 1,000 monocytes, another who did evolve to CML, but had an erratic initial monocyte count of 1,000 not consistently, and another that from the moment of getting more than 1,000 monocytes consistently stay at this level. Of a series of potential predictors of evolution, we found that patients with a percentage of monocytes over 20% and having more than 3 genes mutating had a significant shorter time to evolution to CMML. These variables were faced in a multivariate analysis, and they maintained their significance for predicting evolution to CMML. Interestingly, these variables were also independent adverse prognostic factors for overall survival, and we were able to make a predicting model to CML evolution with a C-index of 0.82. The conclusion is that oligomonocytic leukemia with higher molecular complexity and high relative monocytosis are at greater risk of CML evolution, and that they have poor outcomes. Thank you for your attention, and for any questions or correspondence, you can write to Dr. Calvo at Hospital del Mar.